So if I wasn't a registered midwife, I would have totally believed this woman that commented and said that it is having a lot of sex during pregnancy that causes Vernix Caseosa build up on a baby's body. Because thinking of it logically, the sperm is white in color and it will be covering it will be covering the baby's body, but that is totally far from it. If you're a nursing mother or a nursing father or you plan on becoming one, pay close attention. Now, this is called Vernix Caseosa. It is a protective covering that is usually found on the skin of newborns. If the baby is born before term, it is usually more in quantity, but that doesn't mean that post-term babies cannot still have this Vernix Caseosa on them. The quantity varies due to a lot of factors. Now, Vernix Caseosa is a protective covering on the skin of babies. It has antimicrobial properties. It lubricates the skin of the baby so that it can pass through the birth canal easily. It also helps the baby in remaining warm. So these days, even when babies are born, they do not hurry to just clean it off. And it is not dirty. It is clean. Wow. And if your baby is born with it, it is totally normal. Although not all babies are born with it in like large quantities like this. But if your baby is born with it, it is totally normal. So now let's talk about some common myths that people have about this Vernix Caseosa. So somebody said that my children don't come out to them, maybe because they are both post-term. Well, post-term babies have lesser amount of Vernix Caseosa, but still they could have it. It all depends on a lot of factors, like I said. So another person said, my baby came out with it so plenty, and the nurse said it's because the baby did not pass her due date. Yes, that is correct. Like if your baby is not up to the due date, the amount of Vernix Caseosa is usually more than a baby who is born at their due date. So using a lot of proteins while pregnant is wrong. That does not affect the amount of Vernix Caseosa. Then someone said, if you eat enough fruits, you won't see that on your baby. This is totally wrong. It does not matter what fruits you are eating and the amount of fruits you are eating. It is just natural, but it's good you eat your fruit during pregnancy. So somebody said, use antenatal drugs. Well, you will not see this. Antenatal drugs do not affect the amount of Vernix Caseosa. So guys, that's it about Vernix Caseosa. If you have any question, drop it in the comment section and I'll answer you.